Thank you, Mr. Chairman, and thank you both for being here and for all of the work that the CDC and NIH are doing to address this challenge. I know that Senator Moran asked about the FDA, but obviously there are other federal agencies, Homeland Security, State Department, Department of Agriculture, Customs and Border Protection, who have a role to play as we think about how to respond to this kind of an outbreak. Can you talk about how you're coordinating with other agencies within the federal government to address this?
HHS is the lead dealing with this response and coordinates across many different components of HHS that have to respond. The State Department, for example, uses the CDC travel advice for their advice not only for travelers, but also for our mission personnel under Chief of Mission Authority at Post, including the CDC staff who are there. And we work closely across the U.S. government with coordination wherever necessary by the National Security Council.
And with respect to other countries around the world, the European Medicines Agency, for example, has established a task force of European experts with knowledge in vaccines and other infectious diseases. How are we working with them? Are we part of what they're doing, or what other international efforts are we involved in?
We work very closely with countries around the world. CDC has teams of our doctors and other epidemiologists today in both Brazil and Colombia. We also work very closely with the Pan American Health Organization of the World Health Organization here and the World Health Organization in Geneva as a good way of having a ground where everyone can collaborate together.
Now, New Hampshire has, in the last 15 years or so, had cases of West Nile virus that never used to exist that far north. To what do we attribute the spreading of these kinds of mosquitoes? I mean, is it just globalization? Is it also the warming of the climate that's affecting that? Do we have any analysis that tells us, is this going to get worse? Is it going to retreat? What do we think the future is going to be?
As Dr. Fauci showed in his opening presentation, we do think the continued emergence and re-emergence of health threats, including those spread by mosquitoes and ticks and other vectors, is the new normal. It's going to continue for the foreseeable future. For the mosquito populations specifically, and these viruses specifically, our scientists tell us that the key drivers have been the movement of people from one part of the world to another, because the virus basically hitchhikes inside of someone's blood, and then a mosquito that can spread that virus spreads it elsewhere. And the urbanization, because having lots of people close together makes it ideal for mosquitoes to be able to spread this quite explosively. The mosquitoes that spread Zika, as far as we know, are not present as far north as New Hampshire, but as there are changes in the climate, it may change some of the environments in ways that are very difficult to predict the implications of.
And can you talk about how important registries are as we think about how we figure out where this is affecting populations?
Registries are a key tool to identify affected individuals and enable us to get population-based information and deeper information about individual cases and about the range of illness that can be present.
So someone was explaining to me that one of the reasons this suddenly got the world's attention was because there was a large enough population in Brazil and enough babies born to suddenly see a pattern, and that we have seen in other islands and other places where we didn't have enough of a population to really be able to track what might be happening. And so you talked about the virus got identified in 1947, was that the year? So how can we track back, and do we have any idea what may have happened in some of these other places before we saw a large enough population to be able to identify that this is a problem?
Some of that work will be very difficult to do because the blood test cross-reacts with other viruses. There was a relatively large outbreak in French Polynesia, and in retrospect, what we've heard from various reports is they have identified children with microcephaly born following that outbreak, but we haven't yet seen definitive information on that.
But the point you make is a very good point, Senator, because when you're dealing with a disease, even if it's difficult tracking for the reasons that Dr. Frieden mentioned, when you're dealing with a disease which is smoldering at a low level, and there's a complication of it that's relatively uncommon, you may completely miss it. Once you see a disease in which it explodes in a population, and then all of a sudden you have so many cases that would be otherwise an unusual complication, then you start to see it happen. We saw that with Ebola when, prior to the outbreak of Ebola in 2014 and 15, there were mini outbreaks, as few as 2 and as many as 100. Then when you get 28,000 cases, the way we did in West Africa, we started seeing things with Ebola that we didn't realize were associated with Ebola. I think the point that you made is a good one, because that's the kind of thing why we're keeping a close eye on what is happening, because literally every week or month, we learn something new and important about this.
Thank you. Thank you, Mr. Chairman.